I had a client who was convinced that doing crunches was gonna help her for flat stomach, which I couldn't figure out a way to tell her that's not only not true, it's unscientifically unsound. But she was gonna do it anyways, and people do that all the time. I had a soccer player years ago that I was coaching who she started hyperventilating during the game, and I had to take her out, and it sort of came out that she was holding her core so tight because she was doing like 500 to 1,000 crunches every day, and it's gonna basically keep you extra tight without doing much. But some people have the idea that they get the idea from some aspects of breathing that holding your core tight is a good idea, but they don't understand that doing it all the time is not a good idea. What makes
exactly. Well, if people are holding their belly tight all the time, it just tends to make them tight all the time. Holding your belly tight all the time will often actually inhibit, the diaphragm from functioning optimally. Because remember, your breathing should be adaptive. Your diaphragm does different things depending on what ventilatory and postural needs are. Your diaphragm has to interpret what's going on. If you're always holding your belly tight, then the diaphragm isn't coordinating and communicating well with abdominal muscles. So normally when the diaphragm contracts, abdominal muscles should eccentrically release. You should get some lengthening. And if you're always over controlling them, and you might inhibit some of that eccentric motion, which would allow your belly to just kind of relax a little out. And so it's better to train for functionality than for some rigid form. Okay, so if someone's got a very tight belly, often what they'll start to do is use their shoulders and their accessory respiratory muscles to breathe. So while, you don't want poor abdominal tone, you just want appropriate abdominal tone that's a bit changeable. It turns on and off according to different body states and conditions where you're at, whether you're, in a state of tension, upright arousal, ready to run down a field, or whether you're sitting comfortably, listening to music.
Okay. What's something that people can do every day for the breathing? Just kind of check in. Aside from the question here, you don't have to take those every day, but just physiologically, what could people do every day?
Yeah, I think most people could do with slowing their breathing down when they relax. When they're sitting quietly, they could do with slowing their breathing down and making it lower, slower, and softer when they're relaxed. And just taking time every single day to spend a little bit of time where you sit repeatedly throughout the day and sit and just settle into your body and make your breath a little slower, a little lower, and a little softer. Just gives that nice balance to the hectic lives that we all tend to live.
So if they were doing that, how long would be a normal time?
5 minutes. But of course, the longer you do it, the more benefit you get. Depends how overstimulated and over-aroused your system is. You need to put in, proportionately. The more stressed you are, the more you need to do. But I think just repeated, little times during the day of just putting a little bit of that relaxed, low, slow, soft breathing would do most people a lot of good. But having this idea that, they should do really slow, deep breathing, or, that they need to make their breath big, can lead them into trouble, because thinking that you've always got to make the breath big, I haven't got time to explain it here, but, if your breathing muscles aren't set quite right, trying to breathe too much can actually interfere with your breathing. So just relax, low, slow, soft. That's the main mantra. Low, slow, soft, relaxed breathing.
Here's the last question I have. Can you explain how someone's doing controlled yoga type breathing, even if it's really long, like they're taking a long breath, they just they don't stop, because sometimes I have to tell people that it's okay to take a break in between inhale and exhale, and all they do is continuously breathe.
Yeah, just go. Yeah, people can overbreathe. They can hyperventilate. Some people, with the best intentions, will end up hyperventilating because they're already on the edge. The carbon dioxide's already low. They're already on the edge. And so they do a class where they're breathing too much without a pause. They're not following their body's natural inclination to want to pause, and they can just end up, creating a little bit of disruption in the breathing system.
Okay, awesome. Will you just talk briefly about the upcoming FMS breathing course that you're teaching?
Yeah, sure. So the FMS one-day course is sort of to support the video. So I collaborated with FMS a few years ago to do a breathing video. And that's a sort of an intensive 3-hour training that takes people through that multidimensional model and teaches them some tools for assessing each of the dimensions of dysfunctional breathing, which is basically the biochemical, the biomechanical, and the psychophysiological. And it's really, a pretty brief, sort of condensed version. And so we teach them hands-on techniques in that video. So this one-day course is going to be an opportunity for people it'll be a bit of a review of the important things in that video. And then there's also time for people to practice and learn, get feedback on using some of the techniques like the MARM, the manual assessment of respiratory motion, which is a validated technique for assessing breathing pattern. So we'll do the full version of the MARM, and then we'll do a simplified version of the MARM. We're going to do a bunch of case histories where we talk about people who are patients of mine. I'll explain how breathing was a major factor in helping them with different conditions, and then we'll look at what the results of the various assessments were with those people. And then we'll go into a little more depth on things like using breath holding as a tool for assessment and treatment of breathing dysfunction. We're going to do a brand new thing on that course. I'm going to teach, we might have taught it when you did the 2-day course in Los Angeles last year, but I'll be doing the breathing basics routine, which is
You did that. I think that was the
yeah, you did that. Yeah. So it's a protocol for retraining the diaphragm and retraining breathing muscle coordination using a range of postures and positions. So it's the way that I do it. And we'll all get a chance to practice that and learn how to teach it and so on. So it's hopefully a very nice mix of theory and practical. And I think when people sign up for that course, they get the video as well.
So it's going to be in Des Plaines, Illinois, just outside of Chicago, pretty close to the airport on September 16th. It's coming up, so you should sign up for it, because I'm taking it, even though I took the other one, because I want to get better at breathing. And as a massage therapist, there are parts of the hands-on manual assessment of breathing where you have one hand up here, one hand on the opposite rib cage, one hand on the same side rib cage, where you have to move your hands and assess physically the body very specifically, and you can tell pretty quickly where the restrictions are coming from for people. So just from a massage standpoint, or any manual hands-on release technique, you can kind of pinpoint quicker where you actually need to help the person breathe and where you need to release things to help them breathe. So it's pretty cool stuff. So I'm just
cool.
my journey on it, and I love it.
That's great. Fantastic. I'm doing a couple of other talks in America as well. I'm giving a talk in Denver about sleep apnea. The focus is on sleep apnea. So it's getting the most out of breathing retraining for sleep apnea. So a lot of people think that sleep apnea is all about, the anatomy, whether there's obstruction. But the functional side is incredibly important because it's all breathing related reflexes that either open or close the airway at night. So I'll be giving a talk in Denver a few days after Chicago. So it's about I think it's the 20th in Denver. And then on the 22nd, I'm giving the same talk in Los Angeles, in Santa Monica. on the Saturday afternoon, which I think is the 22nd. And all of the bookings for all that is on my website.
Awesome. Is there anything else?
No, thank you for the interview. That was great. Appreciate it.
Thank you for
Lovely to see you. Lovely to talk to you. Thanks for those great questions. They were really good.